Hello, everyone. Thank you for joining us on Cancer Doctors Podcast. Today's podcast is brought to you by the Utopia Cancer Center in Tampa, Florida. Please check them out at utopiacancercenter.com. Dr. Garcia, thank you so much for coming into our studio today. We really appreciate it. We've been looking forward to having this discussion with you today. For our audience that has never heard about you, obviously we know that you're a medical doctor out in Florida, but for the people that don't know who you are, please tell us a little bit about yourself. Take as long as you want. Help the listener that's checking us out for the first time understand who you are, what you do.
So I went to school at the University of Massachusetts Medical School. I went and did a residency in anesthesiology at Hahnemann University, a hospital that's now defunct. And then I started off in my Mary practice, doing anesthesia. I had a really lot of fun doing it. I was very good at what I did. And then one day, catastrophically, I had an accident that lacerated my right hand, causing the majority of it to become numb. And so my career as anesthesiologist came to an abrupt and final ending. I was very young, and my hands were insured. So there was no need for me to go out and find employment. However, friends of mine said, you're way too young and you're way too energetic to sit on your duff. So you better get something. You better learn another skill set because you're going to start making bad choices. And I reflected and I said, yeah, you're right. I'm way too young. I'm way too energetic. I'm going to make bad choices. And so I conceded the fact that that was going to be the future. And so I sat there scratching my head saying, no, what the heck do I do now? And part of the problem was that for about 6 months, I really couldn't utilize my right hand. So it wasn't like I had a lot to do for 6 months. So a friend of mine called me up and said, hey, there's this guy who has this thing called the Chelation Center. And he needs a doctor because his doctor either left or passed away. And I said, what's chelation? I don't know, but whatever it is, just go do it. All right. So I packed my bags, went down, and got into the place. And people were getting these IVs with all sorts of weird things and what was going on. So I went into my little office and I started seeing these patients and taking their histories and doing the physical examinations and seeing what in places was happening. And it turned out that these people usually either had type 2 diabetes or they had hypertension. Some people had macular degeneration or other cardiovascular issues. And they were there for this thing called chelation therapy with a drug called ethylene diamine tetracetic acid, better known as EDTA. And all of a sudden, it dawned on me that I'm in a place where they practice alternative medicine. I said, holy smokes. Okay, so my brain really got energized. I started saying, okay, now what am I going to do? I came up with this brilliant idea. Back when I was a kid, they had these black and white speckled notebooks. I went to the store and I bought 4 of them. And I brought them back to the office. And I said, I'm going to start jotting down all these anecdotal occurrences because I knew with the bottom of my heart that I knew that this was all BS and that nothing was going to come of this. And I knew that if I just lasted long enough, I'd have enough material to start my own sitcom and sell it to Hollywood. And that was the master plan. I mean, I'm telling you, this was the master plan. So first month goes by and I'm reading about vitamin C and I'm reading about different vitamins and minerals and diet and all these things that was just basically BS according to conventional medicine. And things started to make sense. But every time that the patients came here, they would have their blood pressure taken. And so about 4 or 5 weeks into my stint into doing this, I remember a patient comes in and says, when I stand up, I feel lightheaded. And I looked at the blood pressure chart and I said, well, you're over-medicated because the blood pressure was going down, down, and down. So I wrote a prescription to decrease the medication. And I gave it to the patient. And it bothered me. It's like when you have a knack in the back of your head, it's like, what the heck's going on? Something's not right here. Anyway, that was on a Tuesday. On a Thursday, I took like the world's longest shower because I like to think in the shower. And it dawned on me, I was doing something that conventional medicine said was impossible. Now, conventional medicine says, so with the exception of antibiotics, once you're on a drug, you'll either increase the dosage of the medication or the drug will start working and you'll stop it and change it for another similar or similar in the sense that it will treat the similar problem, one high blood pressure medication for another, for example, but that you're always going to be on the pharmaceutical train. Once on drugs, always on drugs. So this person just taught me that that's not true. Well, wait a minute. Now that really hit me wrong. So then I decided to put the books away and start focusing on what in blazes am I doing here? And I started looking at all these people and I revamped what I was doing. And I noticed that people who had type 2 diabetes, when they do about, 30 to 40 chelation therapies, somewhere between that number, their blood sugar starts to drop. And so their oral medication during those times, now let me give you a time frame. This is about 1992-ish, in early 1990s. All these people start having their blood pressures drop. And not only the blood pressures drop, but also their blood sugar started to drop if you were a diabetic. If you didn't have a problem with your blood sugar, it didn't affect your blood sugar. So if there was no diabetes, it didn't affect it. If you're hypertension, it affected apparently how your body was able to readapt to the stresses of life. And I began to understand that there was an awful lot more to medicine than what was taught in medical school. Now, the education I got in medical school was great. I'm not knocking it, but there's a whole boatload more. And so I started then, because I was so trained in the way to think, I looked for an AMA-approved alternative medical residency, which is a non-existence. And so that turned out to be a big flop. And so then I began to educate myself and read different books. Patients were more than generous with giving me information and letting me go forth and expand. Read Linus Pauling's work and others such as he to broaden my horizons. And truth be told, retrospectively speaking, it was a very humbling experience that during the first 4 to 6 weeks, the patients actually knew more about what was going on than I did. Mainly because the default thinking was that this isn't going to work anyway. It's not going to harm them. It's just going to not do anything. And yet, when I started to see the results, the clinical results, dropping of the blood sugars, dropping of the blood pressures, it was like, there's more to this than just meets the eye. And so then I started to communicate with different doctors all over the world with the ultra-fast 1200 baud modem. Well, back in those days, you would send things off. It would take forever to get, sent, and then to get responses and books. And so little by little, my fund of knowledge grew exponentially. And today I have what I have. Eventually, I wound up having the world's largest chelation clinics. And life went forward.
Interesting. So I want to back up because I know that our viewers that are listening and watching this are going to have these questions. So you were trained as an anesthesiologist.
Correct.
And got an injury, I'm presuming in your 30s, somewhere this happens. If you don't mind me asking, someone's thinking to themselves, what kind of injury? What happened?
I lacerated my hand, and this finger is numb and half the thumb is numb. Ouch. So my first and fourth finger pretty much, and this is 70% of your hand.
Okay. And why, as an anesthesiologist, is that so important?
Well, in order to practice anesthesia, you need to have liability insurance. And one of the things is that if there's a catastrophe in the OR, everyone's going to get sued, whether I did anything wrong or not. Everyone gets mentioned. And one of the questions that they're going to ask is, do you have any injuries? Well, as soon as you say, yes, I have an injury, it's like, please, just give me your limits and we'll call it a day.
Got it. Okay. Yeah, when I think about anesthesiology, I think about the doctor that has to carefully put somebody to sleep and make sure they wake back up.
Well, actually, they induce coma, and then they wake you up.
Okay.
By definition, coma is when you don't react to pain. So when the surgeon cuts you, you don't squirm. If you do, there's something wrong.
Got it. So as you get the injury, you figure out, I need to do something different, right? I can't just sit on my rear end, as you mentioned. And you enter into this world of chelation, which we'll talk about more, chelation specifically. Because you mentioned there isn't, at the time, an alternative medical association per se. You know, there's not some avenue where you can go learn. You're reading, you're doing what it sounds like some trial and error with the patients that you're taking care of, and you're beginning to see some responses. I mean, you're changing their medications. You're thinking a lot about this. What are the top 2 things that came to mind back then when this is happening based upon your conventional training, right? How is it taking a long time for you to come to terms with, hey, there's something to this, or were you fighting against it, I guess is what I'm asking.
Well, it wasn't that I was fighting against it. It was my expectations were, very minimal. I mean, it's like, someone goes to have surgery, their expectations is that the whatever's going to be done to them will resolve their problem. So they have very high expectations. I walked in with just the opposite. I walked in with like Zippo expectations once I figured out what was going on. Mm-hmm. And initially I went there and I was still traumatized by my injury, so I wasn't really clicking on the cylinders. I mean, I was out to lunch. But once I stopped feeling sorry for myself and finally just, said, okay, enough of this nonsense, I started looking at this, and then I needed to figure out how to entertain myself. Now, it sounds kind of like, well, what do you mean you're entertaining yourself? You're a medical doctor, but this is kind of, pretty bad. Mm-hmm. And the answer was, I knew that from the teaching that alternative medicine doesn't hurt people, but it doesn't help people. That's the dogma.
Okay.
So as long as I wasn't going to hurt people, that was an okay place. But then when people started to change for the better, that was the monkey wrench that I didn't quite have a basket for. I wasn't prepared for that. And that's what piqued my curiosity. And then I began to look at things from a different aspect of like, okay, let's find out why this is happening, because it wasn't just that one person. No, it was like about 85% of the people were responding in a similar manner. And so that's what happened. Now, somewhere along the line, I found out about an organization called ACAM, which stands for the American Academy for the Advancement of Medicine. And they actually give courses on alternative medicine and so forth and so on. And at one time, they actually offered a chelation certification, which I did get. And then whatever reason, politics took over and they did away with their certification with chelation. But that's a conversation for another story, for another day. Mm-hmm. But people were, the evidence is there, or the information is there. You just have to sort of overcome your comfort zone. And your comfort zone is whatever you're used to doing. Mm-hmm. Your comfort zone is what you do on a routine basis. So my comfort zone was, hey, I got all these great drugs, and how am I going to throw you into coma today? Okay, and how am I going to get you out? And I always got people into coma, and I always got people out of coma. I never lost a person, nor did I have a complication in the OR. Everything was taken care of just the way it was supposed to take care of, because I was very good at that particular skill set. With this, now it became a whole different animal. However, when you practice anesthesia, what most people don't realize is the anesthesiologist has to know the physiology of all the body parts. We take care of the hemodynamics, we take care of the blood pressure, we take care of the hemoglobin, we take care of bleeding issues, we take care of just about everything from head to toe. Because you don't, at least when I practiced back in the mid 80s to mid 90s in that area. When I practiced there, you were it. And when you called for assistance, it'll show up eventually maybe. But the whole idea was, this was the era of when the cell savers started to come in and technology started to basically creep in. There were no technologies at the time. Towards the end, I believe the Mac Plus was the standard of the Apple computing capacity, where you had the floppy disk that you plopped on top. So that's the kind of technology we had back in those days. You had to figure it out on your own. And that was a very, very great educational platform upon which to build on for the rest of my career.
When earlier you mentioned AMA, somebody watching this, they're going to say, what's AMA? Explain it to us.
The American Medical Association?
Mm-hmm. Who are they? What do they do? Why do they matter?
The AMA, the American Medical Association, can be looked at as a country club. You don't have to take a test to get into it. It's an organization that you request to join. You pay your yearly fees. I've never joined it. They've spent a fortune trying to recruit me. And I'm just not big on clubs. AMA is, might as well be AAA. Although they do come and tow my car, so I do like the AAA.
Is it just for medical doctors?
To my understanding, yes.
Okay. All right. So is it a place where doctors get together to share knowledge, or is it just really to hang out and be together and be a part of an association?
Don't know. Never attended a meeting.
Okay. Fair enough. You mentioned that when you began going into this other world where chelation was being performed, how long did it take you, the evolution from the point that Dr. Garcia is this conventional medical doctor that did anesthesiology to a full-blown, I'll call it a convert, that, wow, this alternative care actually changes people's health? When you're convinced of it?
It's a good question that I don't know the answer to. It's once I bought into the fact that there's a lot more to medicine than what's taught in school and in residencies, that it was on me to go out there and get a vast amount of knowledge, then I just started to consume knowledge like it's going out of style. Now, my brain functions in a peculiar way for me, in that I have a knack for understanding that something may be important, but I don't know what to do with it at this time, but I'll hold on to it. Whereas some people, if they don't find an immediate use for a piece of information, they'll just trash it. So at that particular junction, I was stockpiling a lot of different variables and trying to understand how certain variables affect others. Again, when you do anesthesia as the art of anesthesia, which is the way I practiced it, you find out that you can use similar drugs synergistically, because half of this and half of that actually give you the strength of both those drugs at full dose. However, because you're not using one drug full dose, you don't seem to get the side effects to the greatest extent that is if you just use one drug. So by combining different medications, thus the art, to induce the coma of anesthesia, then you mitigated a lot of the after problems, the side effects, the afterthoughts, the after problems. Mm-hmm. And so what I started to do was to play around to see how can you use different modalities, the Myers cocktails, the vitamin C, the hydrogen peroxide, all these things. How can you use all these different modalities in conjunction with one another? How are they benefiting one another? How do they potentiate the action? And that's been a never-ending quest.
Got it. Interesting. It's fascinating. You, since we're on the topic of chelation, I want to continue on this for a little bit. Chelation is used to detox heavy metals out of the body, unplug some clogged arteries. Talk to us about chelation. Talk to us about why we should know about it, what it's doing in the human body, how it does it, and the type of maladies that it can improve.
All right, so let's talk about how things happen. Nobody knows how any drug works. Okay? We have ideas, And one of the things that actually I learned when I was in that particular aspect of my life in the beginnings was I learned to say a phrase that most doctors shun, which is, I don't know. I don't know is a wonderful phrase. It was so liberating. I just can't explain it. And I remember that one of the patients I was taking care of was a chiropractor. And the person who was in my office asked me a question. I don't recall what it was, but the answer was, I don't know. I have to look this up and get back to you. And so the chiropractor walked into my office, and this is a dig against chiropractors. He just happens to be a chiropractor. Said to me, you know what? You're a doctor. You can't say I don't know. I said, why not? Well, but you're the doctor. You're supposed to know. That's why they're here. They want an answer. And I said, okay. And so I continued saying I don't know when I didn't know.
You were okay with it.
Well, look, you know what? When you tell people you don't know, they respect you for it. Now, it's not, I don't know, it's your problem, go look it up and let me know what you find. It's, I don't know, let me look it up and then we'll discuss what I find. So it's a whole different, can of worms. So that's the first thing and so nobody really knows, okay, how things work in the human body. Now, you're going to be reading a lot about, I guess the latest kick is mitochondria and how the mitochondria does this, that, and the other, and how the DNA does this, that, and the other. And we're going to talk about genes and make genes 101 so that you guys can understand genetics real easily. And we're going to talk about how people want to puff up their chest feathers by spewing forth all sorts of terminologies, with really not understanding how to put them all together. And I can tell you that personally speaking, the best teacher I've ever had was a tree. That was the best teacher I have ever had because it explained to me everything that's been taught to me. And we'll get to that one too.
No, let's hear it right now. How so? How is a tree your greatest teacher?
In my previous office, there's a tree that's outside my office. And at one time, I was talking to people trying to explain how the lungs work. And basically explaining them, I said, look, take this tree over here, flip it upside down, and that main trunk here, that's your trachea, and then it breaks off to these big branches. Now we only have 2 of those bronchi, but you get the drift of how to work with this, and then it breaks down. Eventually, you get to the leaf, and you know what? The leaf is the action. This is where all the processing goes on in this tree. That's where the photosynthesis happens. That's where all the action happens, and then it goes back down, and then back down to the roots. That's how the tree works. Well, let's look at this tree now right side up. Most of the people in conventional medicine starts off in medical school in the trunk. And then after that, you go into specialties, residencies. It could be general medicine, family practice, surgery, neurosurgery, or what have you. And so they're branching off from that main trunk. And so what happens here is that they start going closer and closer to dealing with a leaf. In the process, they begin to lose touch with the tree and the roots of the tree so that they become so hyper-specialized in one little thing that they forget how that little thing interacts with the entire tree. And they don't understand that other leaves may affect that leaf. Because they're just looking at, just take mitochondria. They're looking at mitochondria as if it's all by itself, leaving away all the other organelles inside the cell. So they're looking at basically cellular body parts and forgetting about how everything interacts as a unit. And it's much easier to understand the cell as a unit than it is in body parts. The only person who really can talk about how having a genetic trait does this is a person who understands how the entire body works, every nook, every cranny, every interaction. And nobody knows that. I don't care who you are. I don't care how many Nobel Prizes you can win. You're not going to know that. We don't have that kind of knowledge. We can kind of speculate, and they sort of make the speculation into dogma. And that's where people really just they just hang their hats in dogma.
So the doctor that somebody's seen today in a lab coat, white lab coat, she really doesn't know as much as you think they know.
He puts his pants on, or she puts her pants on, one leg at a time. Okay. They have to eat. They have to sleep. They're no brighter, no dumber than you. Now, they have a skill set. I mean, you certainly don't want me wiring your house electrically unless you want it to burn down. That certainly doesn't mean that I'm dumb. It just means I'm not skilled at electricity or electrical wiring. I can go and learn. So can everybody else. But one of the main features that's on the patient is to, when you're talking to doctors, have them make it 101. Make it so that you can explain what happened to you, to your partner, or to your family, as opposed to letting them speak with $50 words without understanding what's going on. Because without that fund of knowledge, you're going to be making decisions based out of ignorance. Now, ignorance is not to be confused with stupidity. When you're ignorant, it means you just don't know. When you're stupid, you just don't care. So, again, a lot of people walk in, they want information, they're overwhelmed. And then they have to have, usually if it's going to be a serious conversation, I tell them, bring somebody with you. Because that extra pair of ears will hear things that you forgot. But the tree is very important, because when you go look at that leaf, even though I know that there's photosynthesis and I have an idea what photosynthesis does, basically generate energy, I have no idea if that leaf is producing more or less than anybody else, how it's affected by what, all the other variables that affect that leaf, which are part of that tree that are necessary for that tree to function. And that's the whole idea. What we do at Utopia is look at the entire tree. We look at the entire person. And what that does, which conventional medicine thinks is above what our capacity is, what it really does is allows us to fortify organ systems that are not compromised, to help booster them so that they can help the organ systems that are compromised, because our bodies will rob Peter to pay Paul every day. And that's why the tree is important, because it's important to never lose sight of the entire person, not look at the body parts. And when you just look at the body parts, you're not going to get the results. People are not, if you're diagnosed with whatever, you're not a walking whatever. You're still the person who happens to have such and such. But you're still you. So let's work with that, because most people have been healthy more time of their life than they've been sick. So clearly, something changed. And in fact, the conversation sometimes starts with like, okay, when's the last time you felt well? When you have a patient who walks in and says, I haven't been feeling well for, sounds like, I don't know, year and a half. Yeah, a really long time, doc. My question is, okay, when's the last time you felt well? Oh, well, okay, maybe 4 years ago. Okay, let's start our conversation 4 years ago. What happened then? You just can't do that in 15 minutes, though.
Right. Yeah, because what you've just described is that the human body is incredibly complex. There's so much communication taking place every second within the human body. It's impossible to know all of that. And you also just mentioned that in the typical meeting with a doctor, you're meeting with somebody that doesn't know everything and they talk over your head. It's just flying over.
Well, they don't all do that. Some of them do. And the whole point about that is when they're doing that and you tell them, listen, I don't understand, and you still get the same psychobabble, then it's time for you to stand up and remind them that they're your employee. You're paying for their time.
Well, the insurance company's paying for their time, right?
And who's paying the insurance company?
I am, but
okay. So
then why are the appointments so short?
Well, because you accept it.
How so?
I mean, first of all, you don't have to leave when he says, well, you have to leave when he says he leaves because otherwise you'll be evicted. But short of that, you're paying for a consultation. You're not buying 15 minutes of his time. The time is scheduled by his front desk. It isn't scheduled by the insurance company.
So a patient can call the doctor and say, listen, I want to schedule a 1-hour appointment with you.
Potentially could do that. Now, whether the doctor will agree to do that or not, that's a different question. But just because you're there and just because they've allocated 15 minutes doesn't mean that's all you've got.
Okay. What happens if I want my doctor to translate what they're saying to me, in layman terms, and they won't do it? What do I do then?
Explain to him that, you know what, I don't understand what you're telling me, and it's your job to speak to me in a language that I can understand.
Right. One of the things that patients have communicated to me, matter of fact, I took my own little private survey recently of some individuals regarding what they were most frustrated with when it came to healthcare. And one of the overwhelming unified answers from a multitude of people was, I just don't get enough time with the doctor. Mm-hmm. I cannot get enough time with the doctor. And they're so frustrated with that because they don't feel like they're any better for having gone to the doctor. But what you're telling me is force his hand and get him or her to sit in the chair for a longer period of time, or possibly go find another doctor, I suppose.
Mm-hmm. You can do that as well. You're going to get what you're buying if all you're going to do is have health insurance. Mm-hmm. I talked to an acquaintance who paid $10,000 over sticker to get himself a Corvette. And I was telling he had back pain. I said, go to a chiropractor. And he was complaining about, my insurance company won't pay for a chiropractor. And I said to him, you paid $10,000 over sticker to get a vet. Do you know how many chiropractic visits you can get for $10,000? And with a busted back, you can't enjoy your car. It's like people take better care of their car than they do their bodies.
Why?
Because we've been brainwashed into believing. I mean, think of it. There are oils out there that tout 100,000 miles. Use blankety blank, 100,000 mile oil. And what do they do in 3,000 miles? They change the oil. So they're buying 100,000 mile oil, right? And yet they're changing it every 3,000 miles because that's the way we've been trained. Now, I'm old enough to remember the good old days when Ed Sullivan was out there and they had this pot-belly, greased up, stoky, smoking, bald-headed grease monkey stand for, I think it was Fram oil filters. He said like, you can pay me now. And there we go. He'd have an oil filter there, or you can pay me later. And they drop a whole engine. That was the inception of the brainwashing to get your oil changed every 3,000 miles. Mm-hmm. Because people were using the oil for a lot longer than that because no one taught them. And now what we've actually promoted, in my opinion, here is that it is time to use and abuse our bodies. And when it breaks, go to the doctor and he's supposed to give us a pill or a procedure that's not too inconvenient and doesn't hurt. And we don't have to do it too often so we can get better to go back to using, abusing, and abusing our bodies. So we're not taking responsibility. Now, people are going to get upset. Yeah, for those of you who do, you have my apologies, okay? It's a blanket statement and, yada, yada. But you know what? I'm not politically correct if you haven't figured that out by now. So the whole deal is that as a population, we really don't take care of our bodies. And for those who are really argumentative about that, look at what our teenagers really consider food. And so they're not necessarily going to the garden and taking out the carrots. They're probably going to the fast food joint. Mm-hmm. Because that's what's being promoted. And then we wonder why we're morbidly obese. So again, part of being healthy and staying healthy is treating ourselves like we do our car, with prevention versus intervention. And what chelation does is initiates a repair process in the body that gives more flexibility to the arteries, thereby allowing the body to auto-regulate again. Because when you get arteriosclerosis, basically your pliable vessels become PVC. And so your vessels become very rigid. How EDTA does it? Tons of theories. I don't exactly know which one works. What I can tell you clinically is that about 80-85% of the time, if you do it long enough, your blood pressure will begin to auto-regulate much better than it has in the past. You will not be 18. Let's set our expectations at something that's reasonable. But if you can get off of half your medications, you're ahead of the ballgame. Because each medication has. I mean, and again, that's another part of the problem, is that when you start using different drugs, a drug for diabetes, a drug for hypertension, a drug for this, a drug for antacids, a drug for that, all these drugs interact with one another, which is called polypharmacy. And no one really knows how this polypharmacy works inside our bodies. And more importantly, some side effect that one person may have is not the side effect that the other person's going to have. So it's a real cluster of an interesting find.
You're bringing up so many fantastic topics, Doc.
I know.
But speaking to that one, why is it that one individual will have a side effect to a medication, another individual taking the same medication will not have that side effect? Does it just go back to the fact that the body is, so incredibly diverse? Two individuals just are not going to respond the same way to something? I mean, what's going on there?
That's the beauty and that's the frustration of medicine. We're all so similar yet so different. I could take something. I mean, some people, I was in Ukraine a couple of years back. One of my friends in Ukraine, his father-in-law is a specialist in bees. Mm-hmm. And so he gave me this sugar made of, basically it was bee honey that was allowed to basically just dehydrate. And I put a little bit of it in my cup of coffee. Turns out I was highly allergic to that particular bee or the bee preparation. Mm-hmm. I mean, to the point where actually I had a very slight anaphylactic shock, which I said, okay, I guess I'm toast, where my entire vocal cords went, oh, man. And there was no breathing. And I said, oh, I'm toast. Okay, it's like but fortunately, it didn't last very long. It lasted about 10 seconds, and then it opened up.
Wow, scary.
But I've been able to consume different honeys all the time because of the complexities of honey and all the different variations of the honeys. Okay. So why that one? I haven't a clue. Point is, we're all unique and different. That's why medicine is an art. That's why medicine will always be an art. And that's why medicine will never be a science. Because we're not robots. We don't have interchangeable parts. I mean, you take 2 350 Chevy engines, tear them apart, get a competent mechanic, he can interchange that engine together and you get an engine that functions. It may not function as well as with the original parts, but it'll function. Can't always do that with the human body.
When we talk about medicine being an art, we're talking about, drugs, right? Putting drug combinations together in a way that will help you, right? Is that what we're saying when we say medicine is an art?
No, medicine being the art is to try to understand the person in front of me and their complaint. What's driving this complaint? Is it just purely physical? Is there an emotional component? Is there an environmental component? Is there a psychological component? Are there other issues? So we have to look at the entire environment of the person.
But now we're outside of medicine, right? I mean, now we're really talking some type of holistic approach, right? I mean, it's more than just pharmakia, right?
But who says pharmakia is medicine?
Well, that's what they said. They told us that,
Yeah, but then there's no surgery. So you can't just have pharmacy if you're not going to have surgery. So they can slice and dice, and you can have radiation. That's technology, okay? Mm-hmm. And you can have widgets and wadgets that you put in the body. Mm-hmm. That's technology.
Right.
So medicine just isn't pharmacy.
Okay.
Medicine is how whatever you choose to do for that particular problem in that particular person turns out based on how the person wants to do. And one of the biggest tools that is ignored by conventional medicine is what's between our ears. I mean, if you think you're toast, it's not going to end well.
Because of the power of the mind.
Sure.
Okay. Fair enough. So I want to piggyback on this. I want to keep going because this is such a great topic. A minute ago, you said what EDTA does, chelation. Mm-hmm. It makes that makes that pipe inside of me that are more flexible, that's got rigid, blood can flow, etc. Can't just a plant-based diet do that? Can we just unclog the artery with some kale, eat a lot of that on a regular daily basis, maybe 2-3 times a day, and unplug that thing?
The answer is definite maybe. There are some, I've heard some stories, not stories, I've read some excerpts of different practitioners who claim that they have helped people who have hypertension and diabetes with the just totally altering the diet. I don't have any experience with that. So you'll have to find somebody who has done it, who can give you the ins and outs, because I don't know what it takes to make it happen. Because when I set up my clinic, I looked at the Gerson diet, and part of the problem with the Gerson diet is that it's just so compulsory. If I recall correctly, it's I think 6 coffee enemas a day. I think it was 12 juices a day, and so forth. I mean, you're either buying the stuff to make the mess, making a mess, or cleaning up the mess, and sleeping in between.
It's quite time consuming, yes.
Yes, but it does work. But the question is, there's no compliance. So you need to make something that functions, because one of the things that you need to really gauge is using your medicine, having someone do something that then winds up not making their life fun. You want to enjoy your life. So what I try to do is I try to walk that line of not being punitive with the demands on the patient.
Okay. Yeah, because you just compliance is huge, right? Compliance is huge. If a patient won't comply, even if you have the best protocol for something, but if they're not going to comply long term or make that lifestyle change, then the thing's an utter failure. And I appreciate the fact that you said, I don't know, regarding the kale, right? You read some things, but maybe go to somebody that knows more, right? You talked about that earlier, that you're comfortable saying, I don't know. You just gave a great example of it. So tell me this then, if somebody did get chelation to improve their arteries, would you be recommending that after that's cleared up, and I'm assuming that there's maybe some kind of test that can be given to find out how much it's cleared up? Is there a test?
Well, if you want to see what's going on in the coronaries, there's a test called the CT of the coronary arteries. And you can see exactly a 3-dimensional model of your heart and how occluded the vessels are, so that you can see before chelation and after chelation.
Okay.
But don't forget that the body is programmed to degenerate. So I don't want the listeners or the viewers out there saying, oh, well, if I did chelation therapy, then I don't have to do anything ever again, because that's the mentality is like once and done. To really clear out chelation, clear out the plaque requires, depending on how occluded it is, it requires a considerable amount of chelation.
Okay.
Like my dad had an 80% occluded carotid artery. I chelated him 80 times. He wound up having 30%, which is fine and dandy. So you can get dramatic results, but it does require. Personally, I've had the better part of about 180 chelations over the course of my life, just because I take care of my car, I'll take care of my body.
Got it. Okay. So when somebody gets to that point, let's say they've done their 30 or 40 chelations, and maybe they did the before and after exam that you're talking about, and things look really good. It's like, wow, this stuff works. It really cleared it up. What can I do, Doc, at home to maintain this? I know I'm degenerating, which means I'm dying every day a little bit more, but what can I do now that I go home to just kind of like maintain this? What would you tell a patient?
Have fun. Okay? There's nothing that makes a body more alkaline than having fun. Somewhere along the line, having fun got thrown in the wastebasket, or, put in the back of the line or something to this effect. Have fun. Enjoy your life.
Why is that so important? How does that affect my health?
Because if you're having fun, you're going to be as alkaline as you're going to be. And
what does alkaline do for the body?
Pathology, which is to say microorganisms enjoy acidic environments. Healthy cells require an alkaline environment. So, for example, if you take a cancer cells uses a process called fermentation that basically converts glucose into EDTA without the use of oxygen. Our normal cells use respiration on the Krebs cycle, which generates energy with the inclusion of oxygen. So when you don't have the oxygen, the byproduct is lactic acid and a lot less energy. It's very inefficient. So cancer cells that thrive, right, enjoy an acidic environment. Now, let's go back to anesthesia, because I'm telling you, it was like the best lessons I ever learned. I remember when I was a resident, I was doing an anesthetic on somebody who had a large, it was a boil or an abscess at the time. And so at the time, one of my clinicians, the supervisors, said to me, you know what, your local anesthetic isn't going to work well here. And I said, why not? I mean, I've used this lidocaine all the time or Marcaine or bupivacaine all the time. Because it's acidic. It's going to interact with the pharmacology of your local anesthetic. So in an acidic environment, things don't work well. Well, it turns out that our immune system doesn't seem to like acidity. It doesn't work well. It compromises the immune response. So the more alkaline your body is, the better, the more favorable the environment for the immune response. And so if you want to have a great immune system, you want to be alkaline. And so there's where eating the kales and drinking and detoxifying liver flushes, gallbladder flushes, colonic irrigations, coffee enemas, all those things come in to help the body deal with the free radicals that enjoy an acidic environment or cause an acidic environment. So the more alkaline you are, the better it is for you. The more acidic you are, the more immune compromised you become. And if you actually want to look at cancer as 101, Cancer 101 is that you have an immune deficiency. The reason people get cancer is because their immune system's out to lunch.
Regarding alkalinity, this started because you said have fun, because it'll make you more alkaline. How does having fun or humor or laughter, how does that make you alkaline? I mean, has there been a study on this or something? How do we know that it makes the body alkaline? How do I know this isn't just, I don't know, voodoo? What is it? How?
I'm not aware of any studies, but the whole point is that when you have that feeling that things are pleasant, things are nice, you're in that environment where you're really comfortable what's going on, your body's less tense, less stressed,
less cortisol.
Okay. So my point being is that a lot of what people read in journals isn't real anymore. And that's not me speaking. I have a document that I got back in the late 80s. They did a congressional study where a lot of what's being published, and in fact, if you look at JAMA, and if you actually just look recently, I think it was the New England Journal of Medicine, or it was one of the big ones, either the New England Journal of Medicine or Lancet or JAMA, one of those three big ones, published a retraction about COVID. And I apologize for the other two that didn't. I don't remember. Please don't sue me. But the whole point is one of the big three published a retraction of what they did, and it got out there. I mean, one of the things I tell people is don't let your internet doctor
Dr. Google.
Yeah, well, okay. So, don't let him, don't confuse his information with my medical degree and experience. Experience is what Google doesn't have. For that matter, experience is what the internet does not have. Okay?
And why is experience so important?
Because we go back to the fact that you talked earlier about two people taking the same drug having adverse reactions or not having adverse reactions. That's where experience comes in. Because there's going to be something that your complaint about your particular issue is slightly different, although it presents with the same symptom. The history is slightly different than the other guy who presented just with the same symptom. and what works for that second one doesn't work for that. Or it could be like, you know what, I've heard this before, and you know what worked in that time was over here. Let me try that because that seemed to have worked. And people tend to forget about those things.
So really what you're saying is, and correct me if I'm wrong, but the data is maybe knowledge, and that's great. We have the knowledge, but the experience is really wisdom when it comes to the art of medicine. I mean, experience, it's better than anything, right? It's where you get the wisdom.
Well, that is part of it. But the other part is, as I tell patients, is that you are the most important tool in your tool chest to get well and stay well. So part of the problem goes back to where you were talking about, where you get stuck with 15 minutes. So we talk a lot with our patients so that the patient can give me their story in detail. And when they start speeding up their history, and they start, because I'm trying to take notes as people are speaking in my version of shorthand, and they start talking faster than I can write, or their story starts jumping around, I'll stop the conversation and explain to them what I've heard, so that they can correct the narrative, so that I can understand the chronology of how you got sick. How you got sick is crucial to being able to figure out how you're going to get well.
This is so different. This is so completely different than what Joe Smith and Mary whatever is experiencing when they go to the doctor. You're talking about an appointment with a medical doctor to boot that is truly trying to understand the intricacies of the patient's life from the point that they got ill or just before the time that they got ill, moving forward. I mean, am I hearing you right? Is that what you do in your practice?
Yeah. That's why I'm a quack.
You're a quack because you seek to understand somebody.
Well, sure. But I mean, everybody else thinks that whatever I do is FOS. So, I mean, the whole point is that you need to understand that the most important tool that the diagnostician has is the patient. The patient knows why they're sick. My job is to ask enough questions to get an understanding and remind them why he got sick.
Okay.
Or her.
Right. In other words, the patient, when you say the patient knows why they're sick, I mean, they don't consciously know, but they have the data that you're looking for. You're trying to accumulate a certain amount of information from them in this consultation to determine, okay, here is the probable cause of why this person got ill.
Well, indeed. I mean, there are many causes, but here's the deal. People just don't, you don't get information from just speech. I always tell people, I'm not really interested in what you say. That's very important, but I'm more interested in how you say it. Like, do you glance down on the floor when I talk to you about your husband? Are you ashamed of something? Has something gone wrong? Do you cross your arms when I ask you a different question? Okay. Do you turn around? Does your voice go up? Does your voice go down? Do you get upset? The how information is presented also provides a great deal of info.
You do have a reputation, Dr. Garcia, for being abrupt or blunt. So you're looking for a match. You're looking for a fighter.
I'm looking for someone who's willing to roll up their sleeves so I can get in the mud with them and help them get well. Okay? If you want me to coddle you, you got the wrong guy. I've had my kids. I coddle them to a point. They no longer get coddled. They all know that. Ask my daughter. She'll tell you.
All right.
Okay? My point is, yes, I empathize. Yes, I have no desire to have anyone be ill. Honestly, I don't. Mm-hmm. I would love to just be able to have everyone stay well, be well, and medicine disappear, and I'll figure out how to play tiddlywinks. My point being is, you got sick. I feel badly you got sick. I didn't participate in your illness. I didn't participate in your choices. And whatever you chose to do many times over has resulted in whatever your illness is today. And you can go into a whole litany, whether it be environmental, it could be what you're eating, it could be emotional, psychological, whatever it is. All those choices were made in my absence. I usually, when I first meet a person, have not treated them. I am not responsible for the choices made by other practitioners that have resulted in what you consider somewhat less than a desirable outcome or feeling worse. So I'm not going to be your batting ram because somebody else did something different. And a lot of the 1-stars come in because I tell them something that they don't want to hear. Well, you've come to me for an opinion. I'm telling you the opinion based on this. Now, you can take my advice. You can ignore my advice. You can modify my advice. Mm-hmm. And I can live with any of those choices. The problem is a lot of people, especially the 1-stars, want you to suffer with them, in my opinion. And I'm not willing to do that.
You want them to get better and you want to help. Okay. Yeah, because the type of patient you describe that you want to invest your time with, you said you have 1,000 minutes every day, I think is what you said, right?
Everybody does. Do the math.
All right. There's something that I've observed, people that excel in the area of cancer. They have something in common. I call it the 3 C's, that they are courageous people. They are committed individuals, and they're willing to change everything that needs to be changed in order to recapture their health. Call it the 3 C's. And the kind of patient that you want to see fits that bill. In my mind, the person that's like, yeah, you know what? I want to get down and dirty with Dr. Garcia, right? I'm in. I'm all in. I'm fully committed. There's no going back. There's no returns. I'm not going to leave anything in the tank when I do this. There's not going to be any regrets. I'm in all the way. Is that the patient? Is that who you want in front of you?
It doesn't have to be to that extreme, but a person who really wants to get well. And here's the point. Even the person who presents that way really doesn't know that they're going to be that way once you understand the root cause of the problem. In other words, when it's explained to you by myself or by the staff or by both of us. The patient who says, I'm willing to do whatever it takes to get well, sometimes doesn't follow through because they're not willing to slay that which has caused them to have their cancer. So let's look back at the word cancer. I mean, you say the word cancer to people, and 9 out of 10 people will think death. Mm-hmm. How did we get there? Marketing. People associate that cancer is a brutal disease that just kills you 100% of the time, okay? Unless you do whatever conventional treatments they want you to do. And I disagree with that. And so, in essence, one of the foundations of setting up my clinic is I set the clinic up so that I could be wrong. Now, most people say, why the hell do you want to be wrong? Oh, come on, say it.
So you want to be wrong so you know what not to do? I mean, what?
No, it's it's counterintuitive to set up a clinic so you can be wrong.
Right.
But the brilliance of being wrong is that you can be thorough.
Okay.
Because you're going to be wrong a lot if you're going to be thorough. Because you can turn over the stone and the stone doesn't yield something, so what? We turn it back down and go turn over another stone. If you have to be right, you'll be sitting there figuring out which one is going to be right. And you know who loses? The patient. So everyone accuses me of having a big ego, but I have a lot of fun with it. So if you're going to have someone who just wants to protect their ego and be right, then you're going to ponder which stone you're going to turn over. And potentially it will be wrong because you're wrong a lot. If you're willing to be wrong, then you just flip them over like a game and figure out where the cards are.
And do it as quickly as possible.
Mm-hmm. And figure out what applies and what doesn't apply. Mm-hmm. And you tell that to patients, and you know what? Patients appreciate it. When you tell patients, I've set up my clinic to be wrong so that I can be thorough, initially they get a shock, and then they say like, I got it. You want to be thorough, which means that some of the things you're going to ask me to do may not pan out. But I can deal with that because you're trying to be thorough. And so the patient begins to bond with the doctor. Even the 1-star bonds with me because they understand that I want to help them get well.
Are any of those patients, though, concerned with that approach when it comes to, I don't have a lot of time, though? I mean, I got cancer here, right? I mean, I may be gone tomorrow or next week or in a month. I mean, while we're turning over these rocks, I mean, we're losing time if it's just failure after failure, aren't we? And
There aren't that many rocks to turn over.
Okay.
You see, you're looking for the leaf. I told you the tree was a great teacher. I don't care about the leaf. I just want to know what it is. Because once I figure out what the branch is, you'll do the rest. You're leaving. See, people confuse giving you the answer with correcting the problem. Okay. I can't correct you. I cannot cure you. Okay? Doctors cannot cure patients. Patients must heal. And you heal through the immuneness. Excuse me. You heal through the immune system. The immune system is what's going to get you well and keep you well. When your immune system falters, you get ill. So doctors cannot cure. If we could, we'd be gods. And let me just tell you, you don't want me being God, okay?
No offense, but I don't.
So the whole deal here is I would be a real lousy God.
Right.
So my job is to help you understand what the problem is, help you sort of show you how you got there, and then you get to decide whether you're going to change. Because my job is to help you heal, as is every other doctor. Now, a lot of people will disagree. You'll have a doctor who says, I took out that ruptured appendix. I saved your life. Okay. Yeah, you helped them. You got rid of the bad appendix. You stitched them. Okay. But if that person doesn't have an immune system, if that person is immune compromised, there may not be a scar formation. If where you took the appendix from doesn't heal through a scar, eventually those stitches will fail. And you'll get an infection in your abdomen. Mm-hmm. And potentially you could die. Mm-hmm. So the surgeon did his part. He took out something that was infected, potentially ruptured, clean out. He changed the balance of power in your body so that your immune system can get the upper hand and you could heal. Mm-hmm. So doctors do help. I don't want you walking out here to think that we don't do anything. It's just we just can't cure.
Am I hearing you say that by default, the body does want to heal if it's given the right environment from head to toe, that it will do something magical, I guess?
There's no magic about it. The body is programmed to heal. If we weren't programmed to heal, we would be dead. I mean, think about it. And most people don't. Go back to the 1800s. We didn't have medicine to speak of except herbal medicines, and that was not practiced by the Europeans by and large. They were practiced by the Native Americans. Okay? And yet, we're talking today because the human body persevered. Now, again, you look at the life expectancy. Went from the 30s to the 40s to the 50s to the 70s. Okay? So my point being is that the technology and the medicine that we practice today has definitely improved our longevity. So I'm not saying that medicine is bad. I'm just saying that when there is no medicine, then survival of the fittest comes in and the body does repair what it can. Now, if you give somebody who has an infection the right antibiotic, the body has a better chance of surviving the infection. When there was no antibiotic, the body had a tougher time doing it, and sometimes it couldn't. Mm-hmm. It depends on the person. And so what I'm saying is that the immune response is key in getting well and staying well.
It's really encouraging, actually. Yeah, because
it really is tough to kill a humanoid. It really is. I mean, short of acute lead poisoning, okay, bang.
Yeah.
Okay. It's really, the body can take a real lot of pounding. It really does. It takes a lot of abuse.
Wow. So part of your, getting to know this is why it's so important for you to know the patient, mm-hmm. to take the time to ask them questions and to hear their story, to try to find out what is hurting this mm-hmm. human being from the inside out, truly, right? Because when you mentioned Hammer, mm-hmm. was he a doctor?
Yeah, he was an MD.
He was an MD. Okay, mm-hmm. German MD, you said, right?
I believe correct.
Yeah. Yes. So when Dr. Hammer figures out, there's an emotional component to cancer, I think was the topic, traumas. And isn't trauma associated with high stress, or at least for a period of time or a lengthy time, or, raising your cortisol levels? Is there a correlation there, when we talk about trauma, that a human being is under a great amount of stress at that time in their life, which is breaking down the system? As you mentioned earlier, now they're not alkaline, right? They're an acidic environment under all that stress and trauma.
But you're demonstrating what people want to do is find the silver bullet.
Of course. Yeah.
And that's not true.
Okay.
For example, you take a set of parents that puts a perfectly healthy child to sleep at night in their crib, in their room, wake up and the baby's dead. No cortisol suppression in the universe is going to prevent what's going to happen next. Okay? Because all the crazy emotions that go through people's bodies, all the self-loathing and self-punishment and the accusations that'll go back and forth and up and down, all the barbaric things will be said out of grief, all take its toll. So you've got to take all that into consideration if you're going to fix this. And again, that's the wrong word. But see, I can't fix it. I can only help them patch it up because there's no fix.
Have you experienced a trauma like that in your life?
A sudden death?
Or anything like it that just kind of traumatizes you and grips you, and, you're obviously thinking about something right now.
Well, doing what I've done for years does take a toll. And part of that gets you to make a hard shell. So, and
you need that hard shell to protect yourself so you don't get traumatized?
Well, it's you don't want to be, I have to remind myself that I didn't participate in getting people sick. And that's important.
Mm-hmm.
That I'm trying to get them well. And that it's going to be painful. I mean, if you want to get rid of cancer and you don't think it's going to be painful, you're not playing the right field.
Mm.
And so the deal here is that you have to care to a point, and then you have to stop. And so sometimes the one stars come in there with, answering your question that you asked before, what kind of patient I want.
Mm-hmm.
I guess the patient that I want is the patient who's willing to take responsibility.
Yeah, responsibility is important.
Right.
It's important.
I didn't participate in the choices they made.
Mm-hmm.
They made them.
Mm-hmm.
Yet they want somebody else to take ownership for it.
Mm-hmm. Yeah, we're stuck with, we want microwave solutions, right? Microwave healthcare. I get sick. I go to the doctor. He fixes me. She fixes me. I don't want to take responsibility for my life. It's really a mess, right? What do we need to do as a society when it comes to our healthcare or cancer or whatever the malady is? What do we need to do or get through our thick skulls to take responsibility for what you said earlier? Hey, treat this body like your automobile that you love and you care for, right? What's it going to take for us to take responsibility? Does it always have to come to a health crisis before I take it seriously? Do I have to go into that trauma mode and, okay, now I'm going to change? Because prevention's obviously a heck of a lot easier.
And less expensive.
And less expensive than having to do intervention, right? What, as a medical doctor with all these years of personal experience with a lot of patients, what does it take to get through somebody's head? Be responsible with your health, man.
Well, I can tell you what the answer is. And then the second question depends on you,
mm-hmm.
the person.
Mm-hmm.
As a culture, we live outside in. That means people are looking for the attaboys, the attagirls.
Mm-hmm.
Everyone's in competition. Everybody wants to do what everybody wants to do.
Mm-hmm.
Healthy people live inside out. So earlier you said, how do we become a better version of ourselves?
Mm-hmm. Responsible. Mm-hmm.
It's to have compassion. We should start treating ourselves like we treat our neighbors. Because we treat everybody else with much more compassion, understanding, sympathy than we treat ourselves.
What about the people that don't even know their neighbors? There's a lot of those people.
They may not know their neighbors, but they're tolerant. They're tolerant of the guy across the street who plays the music too loud one day or 2 days. Okay? They're tolerant of people that they see every day. But they wouldn't tolerate that from themselves. They hold themselves to being perfect. And the interesting thing about perfection is that it's unattainable. So for those of you out there who want to be perfect, what you're telling yourself is that you will never, ever be good enough for yourself. That's what perfection has evolved into. Never being able to attain it, so you're never good enough. And one of the things that our culture does is reminds us that we're not good enough. That we're always in competition with somebody else. That we always have to do things. So we need to start taking stock in ourselves and being happy with who you are. And it doesn't matter what other people think. However, the teachings from grade school onward, actually pre-grade in school, is what other people think of you. Every time your baby goes anywhere, parents think it's a reflection of him or her.
Yeah.
Okay? Well-behaved kid. Look at my kid. I'm a great parent. My kid's well-behaved. Yo ho ho. It's much better. Hey, when they know how to hold a spoon. Okay? Look at that. My kid's eating with a spoon. Yours is still using their hands. So it's always a competition. So kids learn that they're going to be judged by outsiders. And what we don't teach is to self-judge. And that's one of the things we try to impart to the patients who come to Utopia, which is to learn how to self-judge and stop caring about external judging. Whereas the phrase, again, I don't mind because you don't matter, although it sounds rude, crude, and sociably unacceptable, it's very self-nurturing because you're the only one who should matter. There's a song, I forgot what the name of the woman who sings it, who says, I love you, but I love me more. That's a song. I love you, but I love me more. And that's one of the things that we try to get people to start doing, is loving themselves more. Now, most people don't want to love themselves more, mainly because they think that's selfish. And that's been taught since if you think about you, then you're thinking about being selfish. It isn't. And worse, the N-word, narcissist. You bet I thought I was going to say something else, didn't you? No, narcissism. Okay? I mean, if selfish isn't strong enough, then the system will come up with narcissism. And a narcissist is the guy who gets into the boat, takes an oar, and when somebody else tries to get into the boat with him, basically pounds on their knuckles so that they don't get aboard. That's a narcissist. When you think about yourself first, what you do is you get into the boat first, and then from a position of safety and leverage, help other people come onto the boat with you. That's what we're trying to tell you is take care of yourself first, and then help everybody else. Because one of the things that cancer patients have in common is that they all are extreme givers. They give, they give, they give, they give. And they're fake takers. They say they take something, but they really don't want. It's like, okay, I'll take the last cookie, but does anybody else want that last cookie? Because, I really don't want to take it if somebody else and everyone else has had their cookies and you haven't had one yet. You're worried about making sure that people don't think that you're selfish because you took the last cookie. So we're always self-judging to show how we're martyring ourselves. And what we need to start doing is taking care of ourselves from the inside out so that we can then help other people take care of themselves from the inside out. Because there's abundance. which is the other problem that we have. We live in scarcity.
Mm-hmm.
When you start living in abundance, that there's enough to go around, life becomes easier, less stressful.
And funner.
A lot more funner.
Uh-huh. Yeah. It's fascinating because what you said was you start out by talking about compassion. We don't have enough compassion on ourselves. And just think about cruelty, where you just really kind of hate yourself. You don't matter, right? But this whole concept of, hey, if you take care of yourself first, you take it seriously, you're going to be a lot stronger. You're going to be able to actually help more people, probably, from that position. And you mentioned when it comes to responsibility, it's about, knowing what the truth is, right? And about yourself, first and foremost. And then obviously you can't force people to act upon it, but you would certainly hope they would once they understand what the truth is about themselves. Is that what it looks like to become responsible?
Becoming responsible is realizing that the reason that your life's been so screwed up is because you've made bad choices on a repeated basis. You want to know why your life is effed up? Look in the mirror. Now that you did that, now you got two choices. You can continue being invisible to yourself, which all cancer patients are. They're invisible to themselves. They go to the mirror, they put on the face, everything else, they don't look themselves in the eyes. Okay? So, at one point or another, all cancer patients, I believe, are invisible to themselves. So you need to start looking at yourself. And the problem here is that when you start finally looking at yourself, you're not going to like what you see. Then the question lies, what do you do with it? The solution to that problem is self-forgiveness. Understanding that you did what you did at that time for reasons that were either taught to you or the environment, or you didn't have perspective and you didn't have a timeout or anything else. And this is one of the best blessings that's ever happened to me, because it gave me time to just sit there and be with me. I mean, there was nowhere else to go. I mean, they got tired of seeing me at Publix. They almost offered me a job. Like, would you like to be like a cart guy or something? You want to do something? Be a car park or something? Is it like, no, I can't do that with my hand. Okay. So it's like, there's only so many things you can do before it becomes very monotonous, and then you got to deal with you. Mm-hmm. And most of us don't want to deal with us. Mm-hmm. And once I did that, I realized all the problems, and the problems were me. Because interesting thing, when you really take a look at it, when you take the time to look at all the problems that you think you have in your life, what's the one common thread for all those problems?
Me.
Exactly. Because you're not going to deal with his problems. You're dealing with your problems. Mm-hmm. And if his problems infect you, then you're going to deal with the problem because it's affecting you, not because it's affecting him.
Right.
So once I realized that the center sprocket, the one common thread all my problems will ever have and have had always is me, then it was like, okay, what do I do with myself? Do I blow my brains out? Option number one. Or do I forgive myself? Mm-hmm. I opted for number two.
Right.
Much to the disparity to the 1 stars. I know the 1 stars are upset that I did not opt for number one, but that's okay.
So, personal responsibility, what I'm hearing you say is, take a good hard look in the mirror, right? Instead of saying, I'm sorry, fix yourself, and fix yourself really begins with forgiving yourself. Forgive yourself, and then start there.
Well, you've hurt yourself, right? Mm-hmm. When if you spilled water on my suit, what would you say?
I'm sorry.
Okay. Yeah. So, you start with that. And then the next step is you're going to say, well, that's okay, Robert, I forgive you. Or not. Mm-hmm. And if I don't, then you're done. See, that's the beauty of it. The training is, I spill water on you, I say I'm sorry, and I'm expecting to hear, well, it's okay. That's okay, Carlos.
Mm-hmm. Right.
Right? Mm-hmm. Well, the new and improved version of me that's been walking around for a couple of decades is like, listen, I apologize. I know it was a righteous apology. If you don't want to accept it, that's a you problem, not a me problem. Okay? Because I'm really big on you problems and me problems. And so the whole point is that everybody wants to bring their problems into your neighborhood, make them your problem as well. Mm-hmm. Misery loves company, still alive and well.
Right.
The whole point is that's why you have a line of my problems and your problems. And how far am I going to venture into yours to the point where I got to remind you, yeah, this is your issue, not mine.
Right. Your problem's not my problem. Yeah, for sure.
Now, I want to help you solve your problems.
Right.
I'm just not going to own them. You're the owner. Mm-hmm. That's your responsibility.
Mm-hmm. Yeah.
So everybody's got to come across with the notion of like, okay, we really want to do things. Yep, we really want to do things. But there are boundaries that have to be respected in order to keep people healthy.
So in that relationship with your patients, it's really one about, hey, listen, as a doctor, you're coming in, doing all this evaluation and saying, hey, look, I'm going to provide some care for you, but one thing that's not going to happen is I'm not taking care of you. You're going to take care of you, right? I'm going to provide some care, but I'm starting short of taking care of you.
I just say, look, I can't cure you. You have to heal. That's it.
Okay.
I mean, you can flower it all you want. I mean, you can make it as eloquent as you care for.
Right.
I just like to break it down to the nuts and bolts. I mean, most people are really – my number one complaint is that when doctors talk to me, I don't understand what they say.
Mm-hmm. Yeah.
Okay? Mm-hmm. So that's the number one complaint. I'm going to make it so that it's crystal clear. Mm-hmm. And that's why I'm blunt. I don't want there to be flowers. I don't want there to be landscapes. I don't want to be interpretations. I'm sure you meant, no. I want you to understand what I'm saying.
Mm-hmm. You strive for clarity in that meeting.
Mm-hmm.
Okay.
Black and white. Because
Beautiful.
That's what you're going to get. I'm not going to lure you into here to show you black and white. I'm going to show you black and white. If you like it, yippee-ki-yay-ki-yay. If you don't, yippee-ki-yay-ki-yay.
It's good stuff. I'm sure that there are going to be millions that are seeing this. They're going to say, that is the approach I've been looking for for the last 30 years, right? I need to get it now.
That's true. Or that could also turn into let me go on the internet and give them more.
Right. Of course, right? You got to, there's two sides, right?
But the whole point is, you see, whether it be 5 stars or 1 star, I really don't mind because they really don't matter.
Right.
At the end of the day, the only person stuck with me is me. Mm-hmm. And you know what? Most people don't realize that the only person stuck with them is themselves. Mm-hmm. Yeah. That's the real deal.
Mm-hmm. Yeah, you're going to sleep tonight with yourself, right? So,
you got it.
Mm-hmm.
So if I'm stuck with me, I better learn how to love me.
Mm-hmm. Got it. Dr. Garcia, you are a co-author on a book right here called Cancer Free, Your Guide to Gentle, Non-Toxic Healing. You're co-author. And the latest book that you came out with is called Cancer is a Symptom.
Correct.
Tell me, why is cancer a symptom? Why did you write that book? Tell us a little bit about that.
The reason I wrote Cancer is a Symptom was the following observation. You have, for example, a large-breasted woman who finds a cancer, and the woman says, you know what, I want to have surgery for whatever reason. And she decides that she wants to have a bilateral mastectomy when it wasn't even recommended. But she says, you know what? I don't want to mess around with this anymore. Just, you know what? Please take them both. And they do. And it's a relatively insignificant size cancer as far as physical composition versus the size of the breast. And 6-8 months later, all of a sudden, the cancer's back. Now, to me, that makes zippo sense. Mm-hmm. Because just looking at mass, it should all have been gone. And more importantly, usually what happens is the side that had the cancer has the recurrence. That's one of the reasons that prompted me to go and dig out. And fortunately, I came across Dr. Hammer's work, because it began to explain why cancer, and I explained this, I use this analogy with people on the telephone, it's like your pimples. You got the kid with the pimples, you can pop them, you can put creams on them, you can cover them up. But until you figure out why the pimples are being formed, the kid's going to have a recurrence. Well, that's what happens a lot in cancer. And it's not that the doctors are trying to lie to you, because they're not. I mean, everybody is in medicine in one way, shape, or size to try to help some other fellow human. And when you're dealing with cancer, there's no greater joy than to have a patient who's living after cancer, and you realize you participated in some capacity in helping them heal. And so when I keep seeing these recurrences, I have to understand why is there a recurrence? And more importantly, why didn't it go on the other side, or why didn't it go elsewhere? Why did it go back to not the exact place, but to the same side, if you will? And that was what led me to believe that cancer is a symptom of a different problem. And you can blame it on food, you can blame it on your environment, you can blame it on a lot of different things. But whatever you blame it on, they have one common feature. You have to participate in that environment or in that function. It doesn't matter if something happens on the top of K2, because I'm never going to go to the top of K2. So whatever environmental changes may happen up there aren't going to affect me because I'm not up there. Mm-hmm. So therefore, whatever the etiology of your cancer, I guarantee that one of the components in that is you. Because if you didn't experience it, if you didn't eat it, if you didn't think it, if you didn't visualize it, any of our senses, if you didn't participate, if it didn't touch you directly or indirectly, then it's not part of your existence. So therefore, you are the focus of why you have your cancer. And that's why you're so crucial if you want to get well. And then we need to find out why. Because maybe it's because the kid who eats chocolate gets the pimples, but when he eats some other sweets, he doesn't. So there's something about the chocolate that his body doesn't like. Mm-hmm. So we need to find out why you have your cancer so that then you can make a choice to change it or not. Now, a funny, not so funny, but an interesting observation that I notice is that patients want to negotiate. And that was something that I struggled with for a couple of years until I finally understood and I was able to explain to patients, look, you're not negotiating with me. You're negotiating with yourself. And when I tell that to patients, they take a step back because I tell them, I'm really not that important in your life. I really am not. Yes, you've hired me because I've got experience and so forth and so on. But ultimately, you have all the power to implement whatever I'm trying to teach you or demonstrate to you or explain to you. You're either going to accept it, reject it, or change it. One of those three. And so therefore, you need to understand where you're at, what's going on, and where are you going to go. I'm working on another book, and because every Wednesday we have at Utopia a group session. And unlike other group sessions, this group session is not designed to support other people. It's not a support group. It's a group designed to have you see your actions being expressed by a different individual so that hopefully you will see that you're doing this with your own life. I once asked a patient to pretend that she had a twin and that her twin lived her life, and what advice would you give her twin? And she rattled off a 4-page essay. And I said, great, here's your solution. And she started coming out with reasons why that wasn't applicable to her. So I realized that people are really, really anxious to help other people get their problem solved. Yet they are not willing to take that same advice. And so the purpose of the group is for you to see a reflection of something you're doing, have it click, and say, oh my gosh, I'm doing this as well, so that you'll implement the change you want to implement. Mm-hmm. Mm-hmm. So that's why I invented the group. And that's been going on for the better part of like 25 years, every Wednesday. And it's surprising how many people, how they respond to the the shock and the awe that happens in group from time to time.
Mm-hmm.
Because we're here to rattle people's cages. So in part of this group, I noticed one interesting thing. People crave love. Now, how do we crave love? Well, I thought about that. I went back and I thought, when you're conceived, and I said in my book, I say, look, we're going to limit this. We're going to limit it to a single child pregnancy as opposed to twins or triplets or so forth. And we want it as a wanted pregnancy, eliminating rape, pillage, plunder, just to make life simple. Because otherwise you get lost in the leaves. There comes the tree again. Mm-hmm. So we wanted to keep it focused. We wanted to see it. And I said, when a child is conceived, it's conceived in love. Inside the womb, what is the language that the mother and the fetus communicate with? It's love. There are a ton of hormones. And later on, what happens is, when the kid kicks, mom, if he's kicking a lot, maybe mommy didn't eat someone. Mommy's crazy. Like, what do I have to do to tranquil my baby? Baby's acting out. He's having a field day, or she. And mommy's figuring out what she did wrong. And all the while, when I was inside my mommy's womb, there was nothing I could do wrong. I guarantee. In fact, I liked it so much that they had to go and excavate me. I didn't want out. I knew a good deal when I had one. I mean, I'd probably still be there today if I could, but I'm not. So the deal was I really enjoyed it in there. It was all about me, right? I was totally with the program, and the entire universe as I knew it revolved around me. Then I was birthed. And all of a sudden, we go from aqueous, dark environment to dry, cold, bright, noisier than it was in there because you could hear some noises through the belly. And, when I kick, there's nothing to kick, and my entire environment is upside down, inside out, and I don't know what to do with it. And since I don't process, I'm going to cry because my brain, that's the first response is, I don't know what's going on, help! Because it's a whole new environment. And so during the pregnancy, I got unconditional love. Doesn't matter what I did to mommy, I was never wrong. I never got time out. I never got anything taken away from me. In fact, if anything, mommy would go out of her way to try to pacify me. That's the environment of a healthy childhood inside the womb. So I was birthed with unconditional love, as I submit that all children from a loving pregnancy are. And that's our currency. That is hardwired into every child from the moment of conception. So, you got a cute little kid, everyone shows them off. Hey, look, I got a kid, look at my baby, look at this, look at that. Yep, right? Well, the kid gets, eventually like every new toy becomes yeah, I got to remember. Yeah, I got one of those. So, the novelty wears off. And now when you cry, sometimes when dad is stressed out, he may say, oh my God, can't we just shut him up? Right? So now we start getting feedback, and it's not normally good feedback. When you want positive feedback, it's, oh, can you smile? Oh, he smiles. Oh, look. So you start learning how to act in order to get the attaboy or the attagirl that you used to get for just being you. If you're sitting there and you're by yourself and you're kind of doing something, no one's going to go and pat you on the head. They're going to say, okay, leave him alone. He's so quiet. He's quiet. That's fine. Let's let him be. Okay? And then all of a sudden, you hear this infamous 2-letter word, no. The other N word. Seems like we have a lot of them lately. And when we're inside, we're all about us. The N word called narcissist. So we come out of being all about us, and now all of a sudden we got to share. We got to worry about what mommy thinks, what daddy thinks, what other people think. So we start having to act out to get conditional love. Now I got to act, I got to perform in order to get what I crave, what I'm hardwired to want, which is love. That's our currency. I don't care who you are. That's the currency. is unconditional love, which we trade up or trade down to as conditional love based on performance. So now we have to start performing. And when we don't perform, your parents let you know. How come you only got a 96 when the kid next door got a 98? What are you, dumb? So everything's now based on comparisons. What is this kid doing? What is that kid doing? Okay? And by the way, you're a reflection of me. You better be the best because, if other people don't think that you're that good, then it's going to be that I'm a bad parent. So all of a sudden, you become the brand for the parents. And if you perform well, you get an attaboy, attagirl. If you don't, then you hear about it. And you get lessons or you get taught that you have to study harder or whatever it is. So the expectations are now put on by outside forces. And when you were inside the womb, you were totally self-sufficient. You thought you were the cat's meow. You were everything revolved around you. You were it. Your worth was intrinsic. Now your worth becomes extrinsic. If you're proud about yourself, it's okay if you're 1 or 2 years old. If you get to be 4 or 5 years old and you start bragging, someone's going to tell you that you shouldn't brag. Okay? Because it's not nice. Nice kids don't brag. Okay? If you start tooting your horn, someone's going to turn you down. So it winds up being outside forces have more influence on what you think of yourself, your value of yourself, than what you should do, which is have intrinsic value. Here's what I think about me. Here's what I want to do. Here's why I think I can change the world. No, you can't really do that. And that's one of the problems that people have with Musk. Musk acts like a kid. He says, I can do all this. And everyone says like, no, you can't. And then he does it. And it was like, okay, but other people helped you. You can't take all the credit. But he does. Okay? Because he can. I mean, I would venture to say, although I've never met Mr. Musk, that he loves himself. And I'm proud of him for doing that. Not that I matter. But the whole deal is that we should all embrace ourselves like Musk does. And you know what? If people don't like it, that's a them problem. And this is the problem, is that we grew up in utero thinking that we are it. We were the bomb. It was all about us, and it was. When we get out, it's all about taking care of others. Now, what's another? If it isn't you, it's another. If it's your mother, it's another. If it's your father, it's another. If it's a family member, it's another. If it's a sibling, it's another. If it's a teacher, it's another. If it's your parish, it's another. If it isn't you, it's another. And others want to control the narrative, which is counterintuitive to our hard wiring, which is that we control the narrative, as I just demonstrated or articulated. So we want to control the narrative. Society wants us to comply and to be submissive and to, more importantly, not think too much of ourselves, because if we do, then it's difficult to guide you like a sheeple, which is sheep plus people, which is what most people are, sheeple. They go along with the flow. They don't ask any questions. They accept everything that's given to them. They don't stand up for what they want because, well, what are others going to think about me? Mm-hmm. What's going to happen to me? And so, if you want to think of somebody, look at Elon Musk. I mean, Elon just doesn't care. At least that's the way I interpret his behavior, mm-hmm. which is fine. Okay? The deal is others come into play, and one of the things that others teach you is that you should be a giver. You should not be takers, because takers are selfish. But what does others do? They take everything you're willing to give and ask for more.
Yeah, and just to be clear, you're not saying that people shouldn't be givers, but they should spend some time.
I think people should give to themselves first mm-hmm. and foremost, and then, if there's leftovers, help others, mm-hmm. which is not selfish. Because regrettably and sadly, sometimes people have just enough for themselves. Mm-hmm. And in this world, there's no reason anyone should be having a famine or having to go without a meal.
You mentioned your Wednesday group sessions.
Mm-hmm.
I've had the privilege to be there during one of those group sessions, and was just there recently with some of my other associates, and it's fantastic to sit there in the group session and to see some of those aha moments that you described, where the patients are coming to terms with roadblocks, I'll call them, and how they need to approach this. It's really, really fascinating thing to see there. So, the whole idea of cancer being a symptom, and I just want to restate it back to make sure our audience is clear on this. It's a symptom because there are other factors that are taking place with you, whether that's biologically or call it whatever you want, but from head to toe, there are other things going on in the tree at a root level that are producing this fruit called cancer. Is that fair?
Well, cancer, I believe, in my opinion, is the culmination of you not listening to yourself again and your innate self saying, I've had enough. I'm going to be listened to. And all of a sudden, it's remarkable and actually sad that when people are diagnosed with this thing called cancer, all the things they want to do now become achievable. They wanted to go on vacation. They wanted to take some time off. They wanted to do this. They wanted to do that.
The bucket list.
You got it. And all of a sudden, it's a doable thing. Before it wasn't because of X, Y, and Z.
Mm-hmm.
Okay? Now, here is a huge claymore. Sometimes when people get cancer, the family members start paying attention to them. Remember when we were inside the womb, it was all about us?
Right.
And even the non-pregnant women were all hanging out with the pregnant women, like, oh my God, I remember when I was pregnant, yada, yada, yada. Everything was about you because you were in there.
Mm-hmm.
Now, all of a sudden, you grew up and like people didn't really pay attention to you anymore. Mm-hmm. Now you got cancer. Oh my God, George has got cancer. Oh my God. And they start paying attention to George.
Mm-hmm.
Now George is visible. And every time George spoke, everyone just either walked away or ignored him or challenged him or really didn't pay that much respect. But now that he's got cancer, George perceived that I'm being respected. I'm being seen. What I say matters. What I do matters. How I feel matters. People ask about me. Before I was an afterthought. That person does not want to get rid of cancer. When cancer or any other illness serves a purpose, you want to conserve it. Now, that may sound terrible, ugly, whatever you want to say, but it's true. However, whatever adjectives you want to use with it, that's great, but it's still true. It's true today, it's true tomorrow, it'll be true forever. When it has a value, you will not want to get rid of it easily. And sometimes people do that. I've got a patient. And she basically said that, you know what, before she had cancer, her family basically thought of her as an afterthought. Now, all of a sudden, her mother's come into her life, her father's come into her life. And I said, did they come into your life because you had cancer? He goes, yeah. Really? Before that? No. I mean, I'm telling you, mom's moved in and mom's really, she's very minding her P's and Q's and, making sure that I'm taken care of and asking my opinion. Because that didn't happen before. No, it didn't happen before. Only after cancer. I go, really? So cancer's serving you a function. Yeah, it is. Okay.
So I want to keep my cancer?
To which I said, so therefore you're going to make it very difficult to get rid of it at the very best. Yeah, I know. But I'm working on it. Okay? That's a classic. I mean, if I had a dime for every time I heard I'm working on it, I would be one of the wealthiest men in the world. So the whole point being is that people, when you get something you really longed for, when you get that brass ring, that recognition that you wanted, and you reach the conclusion it's because of cancer, then you're not going to want to get rid of it. You don't want to go back to the old ways.
How do we do the opposite then? Or how does an individual do the opposite where they can work from the inside out, get rid of cancer, heal cancer, and yet receive those other, I'll call them affections that they're enjoying so much? How does that happen? How can we?
Well, the reason people don't get affection is because they never demanded it. I mean, there's these crazy ideas that, look, blood's thicker than water, that saying. Mm-hmm. So if I'm part of this family, I'm getting stuck with this family. Bullshit. I mean, just because you're birthed in a family doesn't necessarily mean you have to stay there. They may be terrible people. I'm like, does Jeffrey Dahmer's sibling, if he happens to have one, say, oh, look at my brother's Jeffrey Dahmer? No, he tries to figure out how to change his name really fast. Okay?
Right. Go pick a new family.
Yeah, there you go.
Pick some new friends.
Yeah. So the whole thing, and don't invite them to dinner because they may be dinner. Yeah. but the whole deal here is you have to understand that people are people. I don't know about anybody else. I mean, I'm happy as a lark that my parents were my parents, but I don't recall volunteering to be their kid. I somehow was there. I was like, okay, don't know how I got here, but okay. Mm-hmm. Okay. I don't recall my kids asking me to be their parents. I know how they got there, but that's a different story. So my point being is that just because you're birthed doesn't mean you're stuck with them. And the problem here is that you have to have enough self-respect and enough self-worth and self-value to say, you know what? If you guys don't value me enough, then maybe I need to find another pod.
Wow. Yep. I'm feeling that, Doc. It's a good word.
You're not stuck there unless you keep yourself stuck. See, remember I said choices you make? Mm-hmm. People know that the pod doesn't want them, but they stay there. Mm-hmm. I had nothing to do with that. Mm-hmm. I tell them that pod's bad for you. Oh, but I just got my mother back. I just got my father back. Mm. You don't know how many years I wanted them to come back. And it took cancer to come back. So do you really think they're back for you or they're back for your cancer? Because when you start taking the identity of on my diagnosis, then you don't want to get rid of it.
Yeah. No, you're talking about, hey, listen, when you know that something's not good for you or relationships, kick the dust off your feet, move on and get some new ones.
So people need to learn, if you want to stay healthy, that, you know what? You can live all your life in unconditional love. All you have to do is self-generate it. And there's absolutely nothing wrong with that. And for those of you who subconsciously need an authority figure, a doctor to tell you that it's okay to generate self-unconditional love, all of it, you have my permission to do this. In fact, I instruct you all to go ahead and provide yourself with totally unconditional, endless self-love. And if someone doesn't understand it, then show them some compassion and remind them that when they were in the womb, you know what? They had unconditional love, and that's what they're missing. And that's what we are all missing. And all of a sudden, once you start giving it to yourself, the rest of your life becomes a little bit easier. Or at least mine has.
Yeah. Man. Incredible. Almost sounds like an evangelistic message.
Oh my God. No, you don't want me being a priest. Screw that idea.
All right.